Have you ever felt that sudden, uncomfortable burning sensation rising in your chest? That familiar feeling of heartburn can really put a damper on your day. It is an unwelcome guest that most of us have experienced at some point. Well, the good news is that yes, over-the-counter options are indeed very effective for providing relief from acute heartburn. They offer a convenient and accessible way to tackle those unexpected flare-ups, helping you feel comfortable again quickly. The effectiveness comes from how these different medications work to manage stomach acid. There are primarily three main types of over-the-counter options. First, we have antacids. These work very quickly, often within minutes, by directly neutralizing the acid that has already made its way into your esophagus. Think of it like pouring baking soda onto a small acid spill. Second, there are H2 blockers. These medications, like famotidine or cimetidine, work by reducing the amount of acid your stomach produces. They do this by blocking histamine to receptors, which are involved in acid secretion. They take a little longer to start working, typically 30 minutes to an hour, but their effects can last for several hours. Finally, you might see some over-the-counter proton pump inhibitors, or PPIs, like omeprazole. These are the most powerful acid reducers available without a prescription. They work by directly blocking the tiny pumps in your stomach lining that produce acid. PPIs take the longest to start working, sometimes a day or two, but they provide the most significant and longest-lasting acid suppression, often for up to 24 hours. So, how do you choose? For fast, on-the-spot relief from occasional heartburn, antacids are your best friend. They are perfect for when symptoms strike unexpectedly. If you know you are about to eat a meal that often triggers your heartburn, taking an H2 blocker beforehand can help prevent symptoms from even starting, providing longer-lasting protection. Over-the-counter PPIs are generally reserved for when you experience heartburn 2 or more days a week, and they are typically used for a short course, like 14 days, as directed by the packaging. Always remember to read the labels carefully for dosage instructions and any warnings. Understanding these different mechanisms of action is key. You are not just taking a pill, you are choosing a targeted approach. Whether it is the immediate acid neutralization of an antacid, the sustained acid reduction from histamine to receptor blockers, or the powerful acid suppression of proton pump inhibitors, each option offers a distinct benefit. Knowing which one aligns with your specific heartburn needs empowers you to manage your discomfort effectively and confidently. This knowledge transforms a simple purchase into a strategic decision for your well-being. By having these effective over-the-counter solutions at your fingertips and understanding how each type works, you gain valuable control over acute heartburn. They empower you to quickly address that uncomfortable burning, allowing you to get back to enjoying your day with comfort and peace of mind. Always consult a healthcare professional if your symptoms are severe, frequent, or persistent.